A bill titled Allowing Greater Access to Safe and Effective Contraception Act was introduced by Iowa Representative Ashley Hinson on June 7, 2024. This bill will give priority to certain drug approval applications if they are for non-emergency oral contraceptives that are not intended to induce an abortion, and not required to be prescribed by a physician in order to acquire it for adults. This priority means that the Secretary of Health and Human Services will review and decide on drug applications faster. The fee for these kinds of applications would be waived. The drug to be reviewed would still have to be deemed safe for over-the-counter sale, meaning it does not require a prescription from a medical doctor, to minors and must still be classified appropriately by the Food and Drug Administration. This bill will apply to all pending applications as of the date the bill is passed and all applications that come after the date this bill passes. Within 1 year after the bill is passed, the Comptroller General of the United States, the person in charge of tracking federal funds, will give Congress a report stating how much federal funds are available for the next 15 years after the bill is passed to reimburse contraceptive fees, keep inventory of contraceptives, train medical providers, and educate patients. These funds will become available through the programs listed on screen, including Medicare and Medicaid, Indian Health Service, Social Security, and TRICARE for military members and veterans. Primary impact: more available contraceptives will mean easier access to prevent unwanted pregnancies. The inclusion of the restriction of induced abortion medication part of the bill lends to maintain focus on the prevention of pregnancy instead of termination of pregnancy. I am not going to comment on the morality or legality surrounding abortion, just record the factual evidence and logical conclusions presented here. Secondary impact: any time you put a shorter time limit on anything, something else will have to be sacrificed in order to achieve it. In the case of project management, which encompasses pretty much all initiatives, the three factors are cost, time, and quality. If time is reduced, you will either have to increase cost or reduce quality. This has two potential impacts that can also happen together. First, the added cost of implementing a program eat into the budget or increase the taxes required by citizens in order to cover down on funding. Second, if speed is required, less testing and checking on the drugs are bound to happen. This means future effects of drug administration may not be seen before it is too late for many individuals. This is not guaranteed, but the risk is always there, only being increased with a reduction in quality. Tertiary impact: as population issues rise, the availability of pregnancy prevention medication increasing would directly result in less pregnancies, obviously, meaning a slowing population growth or even a decline. This can have drastic effects on an economy in the long run, as was seen in Japan before the turn of the century, and still ongoing today. With less children being born, the average age of workers producing for a nation increases, leaving the older, less productive generation to produce for the younger generation that cannot produce or does not have the experience to produce effectively. The older generation also loses out on the benefits of a younger working generation propping them up once they can no longer produce for themselves.